Welcome all. It's nice to see you here. I'm Sheena Arthur. I am Partnership Manager at Glasgow Council for the Voluntary Sector and delighted to be welcoming you today. We are on Zoom, as you can see. Please use the chat function at the bottom of your screen and participate as you feel comfortable to do so. We are recording so that we can share the inputs from today. So again, if you're not comfortable with your camera on, or you I'm reliably informed you can change, you can anonymize yourself with the technology. I think that's in your functions below as well. If you go into your own name, you can change that, or whatever you're comfortable to do. But please do make yourself comfortable. We have a great discussion scheduled today. Health in a Changing City, and our colleagues from Glasgow Centre for Population Health are here to share their report, and that's Bruce White, Catherine Timpson and Mary Young, who will all be taking time to share bits of their report and also give us time for discussion and questions, which I think is a really valuable part of this session today. So please do feel that you can use, there's the little chat function at the bottom if you want to ask a question or make a comment, or use the reactions if you want to use the icon for putting your hand up if you'd like to say something or ask a question. Or if you're fighting with technology, just stick your hand up and myself or Lynn will find you. So please use whatever works for you to be part of this discussion. I think that's really important today. And some really interesting discussions to come and insights from this report and the breadth of areas that we're going to cover in terms of the health of Glasgow City. And some of you will know in our World Reimagined sessions, there's been a lot of strong themes that have come up around the experience of ourselves and our citizens in the city, the inequalities that people have been experiencing, and the additional challenge of the pandemic. And I really want to acknowledge that a lot of our discussions are not easy discussions, but they're really important discussions, and it can be overwhelming at times. And in our preparation for this event, we had a really stimulating conversation with colleagues from Glasgow Centre for Population Health, and also with Dr. Sam Smith, who is kindly joining us today, the Chief Exec at Sea Change, with a strong input on human rights and how people are included in this discussion. And we really wanted to acknowledge that it can be overwhelming and it can be difficult, but also we have to find solutions and ways of working together so that this isn't just something difficult to talk about, and to take to our statutory colleagues in terms of solutions and how we can work together collectively. So I want to just support us all to keep that in mind as we go through the conversations, but certainly not to demean how difficult has been and continues to be for many. So I'm going to pass over. I want to thank Lynn, who is making all this happen with our technology and getting us all here, and thank Bruce White is here to start off from Glasgow Centre for Population Health. Bruce is the Public Health Programme Manager there. So thank you, Bruce, and I'm going to hand over to you now.
Thanks, Sheena. So I'll just try and share my screen. Can you all see that?
Yes.
Good. Slideshow. Great. So good afternoon. Nice to meet you all. And thank you for inviting us to speak to you today on Health in a Changing City. This is a report that we actually published in August of last year, and it describes trends in health, demographic factors, socioeconomic factors and environmental indicators over the last 20 years in Glasgow. The report runs to over 130 pages and can be found on the GCPH website, but you'll probably be glad to know today we're only really going to give you an overview of our key findings or recommendations coming out of the work. We'll do this in 3 sections of around 10 minutes each, and then we'll open up discussions after each section to allow you to raise questions of your own or make points. And finally, just to explain, the quote on the left-hand side of the slide is there to explain why we do this work. Our centre, the Glasgow Centre for Population Health, was established in 2004 in order to generate insights and evidence to support new approaches. And ultimately, our work is about trying to inform and influence action to improve health and to tackle inequalities, particularly in Glasgow and the west of Scotland. I'm putting these questions up just now. We've raised these with other audiences when we've presented this work, and it really just reflects our desire to disseminate these findings as widely as possible and to see our recommendations acted upon. So I'll come back to these questions, but these are the sorts of things that we're wanting to kind of find out. Do you agree with these recommendations? If you do, what needs to happen to achieve them, and can you help us with this work? So we're going to go through these different topics, and the slide there just illustrates the topics we'll be covering, and the key findings and recommendations will be covered for each of those. So the first one I'm going to take you through is in relation to population inequalities and life expectancy. So firstly, in relation to demography, Glasgow's population has grown quite significantly in the last 15 years by about 60,000 population, but that growth has tended to be strongest in the least deprived parts of the city. Also, Glasgow's a relatively young population just now, and that's influenced by the large number of students in the city. But the city's age profile is set to get older over the next 25 years. So most of the projections are pointing to an aging city. And then just looking at some of the other key stats in relation to life expectancy, the trends here, I'm afraid, are pretty depressing. Female life expectancy has reduced in recent years, as has both male and female life expectancy in the most deprived parts of Glasgow. So these trends have led to a widening of health inequalities, and in this case, the life expectancy gap has widened, and I'll illustrate that in a couple of slides' time. In terms of the COVID impact, I think it's fairly clear that the pandemic has clearly caused thousands of excess deaths and hospitalisations, and very clearly it has exacerbated many of existing health inequalities, making them worse. However, it's also worth, this last point, it's also worth noting that as we emerge from the pandemic, the impact of recurrent deaths associated with pre-existing inequalities prior to the pandemic will quickly surpass those due to COVID. Just putting this slide up to come back to the population demography. It's significant, I think, that Glasgow is becoming a much more ethnically diverse population, and that's what this slide illustrates. So about nearly 20% of the population is born outside the UK, and if we look at young people, about 25% of young people are now coming from a Black or minority ethnic background. So this slide illustrates what I was talking about earlier, the trends in female life expectancy. So just to explain it, the female life expectancy for women in the least deprived parts of Glasgow are shown in red, compared to females living in the most deprived parts of Glasgow in blue. And so what this is showing is that in the 20 years since 2000, the life expectancy gap between these two groups has widened significantly, and that's by 3 years, from about 8.6 to about 11.6 years. One of the key reasons for this is that around 2012, female life expectancy in deprived areas in Glasgow started to reduce. And this is a trend that we actually observe for men, and we see it in the most deprived populations of other cities in the UK. So it's not purely a Glasgow issue. Most researchers who have done detailed analysis of recent mortality trends in the UK associate this with austerity policies of the UK government brought in particular in the aftermath of the financial crash of 2007-8. And as our colleague David Walsh has commented on recently in a blog, long-standing poor health in Glasgow and worsening health trends in more deprived parts of the UK have their roots in political decisions. And the so-called Glasgow effect, as it's sometimes known, does not solely affect this city, but many parts of the UK. So it's a political effect and it requires political responses. So coming to our recommendations, we've got two broad sets of recommendations to address what are really quite grim health trends. At government level, we need to progressive fiscal and welfare policies from the Scottish and the UK governments to reduce educational income and wealth inequalities. Reversing social security cuts at a UK level would be a good start, but in the absence of this, we at least need policies from the Scottish Government that mitigate the impacts of austerity policies and protect people's incomes. And at local level, we need local policies actions built upon the principles of social inclusion, poverty reduction and sustainability that also build on the good work that's already going on in Glasgow. So I'll come back to this later in the presentation, where I'll come back with some national and local examples of where we are seeing some positive policy responses. But now I'm going to hand over to Mary to talk to you about mental health.
Thanks, Bruce. Hi, everybody. So I think we all know that even before COVID, mental ill health in Glasgow was a considerable problem. And we know that the rate of hospitalisations and prescriptions associated with mental ill health was higher than the national rate. And then given the last couple of years, we've then seen this additional increase in mental ill health across numerous more vulnerable population groups. So this is including young people, women, low-income households, frontline workers. And we've then got this additional pressure on NHS and social care services to cope with the burden. But what we're starting to see is there's also inequalities in access to support is becoming more apparent. So take, for example, mental health support between children, young people and adults. The Scottish Government target is that 90% of people start their mental health treatment within 18 weeks of referral. But we know that in late 2020 in Glasgow, only 61% of children and young people were seen within this timeframe, and that's compared to 89% of adults who were seen within that timeframe, despite the fact that there was actually fewer children and young people referred for treatment compared to the adults. And what we're also seeing is similar patterning being found across Scotland. More recent data shows us that there has been an overall improvement in terms of the waiting times since then, but the inequalities between those two groups still exist. Now, we know that there's been a concerted effort recently to increase mental health support and funding across Scotland and Glasgow, but we do feel strongly, and it's included within our recommendations, that there needs to be greater sustained investment available now, particularly in community mental health care, so that we can reach people before they're hitting a crisis point. And it's vital that any spending also includes a spending in CAMHS, which has been underfunded compared to adult services. We also recommend that the current 18-week target waiting period for mental health treatment should be reassessed, given in light of those inequalities and waiting times that we've discussed. And I'll just pass over to Catherine now, who'll talk to you about poverty and economy.
Thanks, Mary and Bruce. So within Glasgow's economy, low deprivation in Glasgow relative to the rest of Scotland has fallen in the time period we looked at for the report. Several measures of poverty are worsening. Child poverty had grown in the last reported year, food insecurity had gotten worse where it was being measured, and in-work poverty rates were increasing. During COVID-19, employment rates in Glasgow did rise, despite the fact that they fell in most other areas of the country. But the rates in Glasgow remained behind those of Scotland and of the rest of the UK. And at the same time, the number of benefits claimants in the city rose dramatically. If you can go to the next slide, please, Bruce. I've got a chart that illustrates that point. So every bar here represents a neighbourhood in Glasgow. The blue at the bottom shows how many people were claiming universal credit in January 2020, so just before COVID-19. The orange shows the increase between that time and January 2021. So the full bar is how many people were claiming universal credit by January 2021. So you can see it's quite clear that there's been an increase in basically every neighbourhood in the city, and in most neighbourhoods quite dramatic increases. If you go over to the next one as well again, thank you. So this slide looks at the trends in fuel poverty and extreme fuel poverty for both Scotland and Glasgow. Fuel poverty has been dropping since around 2010. Has been dropping between around 2010 and 2019, although there was a bit of a rise after that 2015 to 17 year. Extreme fuel poverty has been rising, The latest data that we have for this is still before COVID-19. So we haven't really seen the impact of that, and we certainly haven't seen the impact of the increase in fuel costs that we're now experiencing. We'd expect these numbers to be higher already and to keep rising as long as those costs continue to rise as well. So what recommendations have we set based on all of that? Well, our recommendations look at both local and national level policies. We've recommended keeping up, or now we're saying reinstating, the benefits increase that we saw during COVID. We've also talked about better compensation for people who are in work, and particularly for people who were considered essential workers during the pandemic but are still often not paid a real living wage. We've also looked at wider scale economic policies that have a focus that goes beyond growth, and the involvement of people who have had experience of poverty whenever we're making economic policy decisions, so not splitting those into two separate areas, economy and poverty. I'll move on now to housing and homelessness. So dwellings in the city grew by 6% between 2001 and 2018, and the proportion of housing that was privately rented also grew during that time. In 2001, about 6% of the housing in the city was privately rented. By 2018, it was up to 20%. In 2020 into 21, the latest year we had figures for, a quarter of the people assessed as homeless in Glasgow were children. And that's even though children only make up about 16% of the city's population, so they're overrepresented within the homeless population. Within homelessness policy, pre-pandemic, we saw a lot of partnership working on homelessness prevention and on rapidly rehousing those who were made homeless. During COVID, more focus was placed on getting people indoors and away from rough sleeping, and on homelessness prevention by pausing evictions due to rent arrears. So that policy did stop people from being made homeless, but it didn't stop people from accruing debt during that same time. The successes that we did see during the pandemic relied on existing partnership working, so partnerships that had been set up before COVID appeared, and particularly those that involved people with direct experience of homelessness in decision-making roles. But they also required changes to legislation and the provision of new funding sources. So our recommendations try and reflect all of those positives that we did see. But we also highlighted within the report the need to make housing more affordable for everyone and in the longer term. That requires us to think a bit more structurally about how the housing economy works and how we can work on the drivers of poverty and homelessness. So I've got a slide for it, yes. So we're going to take a short break just now for discussion, any questions that have come up in the meantime. We've got questions here for you, but if you have any thoughts, just please jump in with them just now. Okay, I'm seeing a question in the chat, which is about the last section that we just did, so I'm just going to jump into that quickly. So how are we defining extreme fuel poverty? So fuel poverty and extreme fuel poverty, the measures that we are using, fuel poverty is if a household has to spend 10% of their income on fuel, and extreme fuel poverty is if a household has to spend 20% of their income on fuel. And there's a second part to that question I'll just read. So yeah, and for the universal credit figures, no, they are just people on universal credit, because that is how the data was presented. You've got universal credit and other benefits are measured differently. And so there was already a rising number of people going on to universal credit as more people moved over to it. But the impact of COVID was that a lot of people came onto universal credit who hadn't necessarily been on legacy benefits beforehand. Those are the two questions I can see there.
You mentioned housing, and I wondered about where the mid-market rentals fall and the impact that that has in terms of in-work poverty, because even though it's lower than the private rent, it's still higher than social housing.
Yeah, I think that's certainly what I would say. Although it is cheaper than private renting, it is still higher than social housing, and it's still higher than yeah, it's for example, it's still a very high at a very high level if you are not working. If your income is from benefits, it's still above that. So it still causes issues for housing affordability.
If we don't have any more questions just now, we can just keep going, and we'll have another 10 minutes, and then there'll be another chance to have a discussion. So shall we just keep going just now?
Yeah, fire away, Bruce. Yeah.
Okay, right, I'll just reshare my screen and get going again.
And if people have more questions that they want to put in the chat as well as we're ongoing, we'll come back to them. Okay, so starting this section with the fact sheet about disability. So nearly a quarter of the adults in Glasgow in 2011 had a limiting health problem of some kind, and 9% of school pupils in 2019 said they had an illness or a disability that limited what they could do. Disabled people are more likely to experience poverty and housing issues, and the gap between the employment rate of disabled and non-disabled people was around 20% in Glasgow in 2019. Across Scotland, although employment rates for disabled people were higher than they were in Glasgow, the gap was nearly 24%. Disabled people also faced more risk during COVID-19, particularly people with learning disabilities, and the impacts of the pandemic hit disabled people harder. They're more likely to be food insecure and more likely to be digitally excluded during that time. And we've produced a micro briefing along with Glasgow Disability Alliance that goes into more detail on those and on other impacts. So our recommendations here focus on involving people with disabilities whenever we're planning public spaces and public services, but also on making sure we tackle the digital divide. And we've highlighted how the economic recovery, needs to provide fair, secure and well-paid work. And it needs to be targeted at those groups who we know already faced barriers to employment before COVID-19. I'll move on to children and young people here. So those aged 0 to 14 were more likely than any other age group to live in the most deprived areas of Glasgow. And there's a similar, although less pronounced pattern across Scotland. Looking at their mental health, figures from 2019 suggest that about 22% of the adolescents in Glasgow had an emotional or mental illness. And that's still pre-COVID figures, so we know that's had an impact as well. During COVID, Mary's already discussed how children waited far longer for mental health treatment than adults did. But the impacts of shutting schools were also worse felt by children in low-income families, disabled children, and the children of lone parents. And a similar pattern was seen around access to green space. Households with children were also more likely in general to experience food insecurity than households without children. So for our recommendations here, we've discussed further expansion of flexible childcare options. And again, we've looked at tackling digital exclusion. So that means both providing digital access for everyone, but also making sure there's always an alternative way to access services. The chart here shows the population of Glasgow, and it's split into these deprivation deciles across the city, and it's also split by age. So each group of bars here is a deprivation decile, and you can see that we've got the most deprived on the left and the least deprived on the right, and you can see that the pattern is skewed towards the more deprived areas of Glasgow. But that pattern is most pronounced for that youngest age category here in a light orange, with over 35% of children aged 0 to 14 being in the most deprived decile of the city. The age group with the smallest proportion living in the most deprived areas of the city is actually the next group up by age. It's those aged 15 to 24%, for whom just under 25%, aged 15 to 24, for whom just under 25% are living in the most deprived areas. I'm going to pass back over to Mary now.
Thanks, Catherine. So I'm going to have a chat to you now about gender inequalities. This is a section of report that we looked at. We know that gender-based violence is increasing, and it's been exacerbated by the pandemic. In Glasgow's got some of the highest rates of domestic abuse within the country. Reported sexual crimes have more than doubled in the last decade in Scotland, and most of them are occurring within Glasgow. And Glasgow is also thought to have, although data is very limited, a high proportion of women who are working within prostitution, and many of whom experience threats to their safety, abuse, discrimination, harassment on a regular basis. Research also shows us that women and non-binary people experience increased vulnerability and discrimination in public spaces. And what we know is that even if there's no real threat, it's that increased sense of risk and that potential for threat that can then limit and influence how women and non-binary people use public spaces. But what links a lot of this data together is the reporting element, or rather the underreporting of gender-based violence. The doubling in reported sexual crimes, for example, in Glasgow, yes, we can see it in a positive light, in that perhaps people are now more confident in coming forward to report the crime, that our crimes are being handled in a more positive manner, for example. But that said, it's still a massively underreported issue. We've got UK data that shows us that 86% of women have experienced sexual harassment in some form in public. Only 4% are then reporting the incident. Underreporting isn't exclusive to women in Scotland. It's connected to subgroups of people who experience marginalisation or discrimination. So, for example, people who identify as LGBTQ+, disabled, people of colour, people working in prostitution. Now, we touched on many of these issues, including this intersectionality of gender inequalities and violence in a series of blogs that Catherine and I co-wrote to mark International Women's Day. And here and in our report, we recognise that in order to address gender-based violence, we need to first of all address the entrenched gender inequalities that occur within our society, which is of course no mean feat. So I'll include a link in the chat function for those blogs. But some of our recommendations in the report was that we recommend the Scottish Government lead a national inquiry into sexual harassment in all aspects of women and non-binary people's lives in Scotland. And the idea is that you can capture that lived experience and offer strategies into tackling the issue in the long term. And we also recommend that a greater focus should be placed on gendered perspectives and lived experiences when planning public spaces and services. And if we move on to the next slide, thank you. So here we're also looking at ethnic inequalities and racism. So throughout our report, we highlight inequalities in health, economic opportunity, housing, poverty, etc., that are experienced by people of colour. But yet data on ethnicity is often missing or it's incomplete in many administrative systems. So if you take domestic abuse, for example, as I've just discussed, we know it's such a big issue in Scotland, but at the time of writing, neither Police Scotland nor Scottish Government are giving a breakdown of domestic abuse statistics by ethnicity. But this in itself then becomes this double-edged sword, because if we're continuing to collect data on ethnicity, it feeds into this sort of tendency to use ethnicity as the central defining characteristic, which then can dilute and disguise disparities between ethnic groups, when instead we know that it's racism in particular that is the driver of ethnic inequalities in health. But we know so little about the relationship between ethnic inequalities in health and racism because research is in its infancy, we've got limited data, particularly within a Scottish context. So in our recommendations, we recognise that we do need to better understand the impact of racism and access to and use of services across the city. And the absence of this type of data really just serves to dismiss the lived experience of people of colour, and it further inhibits our understanding of inequalities. So our recommendations were first of all to make ethnicity a mandatory field in public records, but with the provision of data quality monitoring at local and national levels to ensure we've got good quality data. But more importantly, we're recommending that researchers, planners, organisations, policymakers, etc., are also starting to collect data on the experience of racism as well as standard. If we just pop on to the next slide, we can then take another 5 or 10 minutes to take any questions in the chat function, or if anybody wants to raise their hand, please do.
Just to say, Mary, we're having a few techie issues at the moment, so forgive us.
Just caught up with the chat. Yeah, I'm not seeing any questions coming up in the chat function
Fine,
either.
Apologies
Okay.
if you're missing some questions, I think are popping up. So please just fire questions in the chat or just raise your hands. We'll pick you up that way.
Yeah, thank you very much. There's some really powerful bits of information that I think possibly people might be processing in order to think about questions. But while we wait for questions coming in, there's a few things that we were thinking about that link with our previous events. And it was right at the start, Bruce, talking about the sort of the political impact needs a political response. So, thinking about recommendations about people being involved in decisions that are made and people with lived experience being involved in all of these themes. Have you got recommendations about how we can influence that or do that better?
I was thinking that actually, Catherine, about the Wise Women report. It's quite a nice example, isn't it, of how to involve the individuals that are experiencing harassment or sexual abuse on a daily basis. So Wise Women essentially created an app. I think, Catherine, you're better at describing this than what I am. They created an app with the Glasgow Girls Club, and the whole idea was that you can pinpoint into exactly where in the city you'd experience in any form of harassment or abuse or discrimination or anything that you'd experience, whether it's from an organisation, a shop, a street, a place of vulnerability. And the idea is they were then collecting lots of data as well through focus groups and interviews, I believe, to really capture what it's like to be a woman or a non-binary person living in the city, so that any recommendations are built precisely on the types of issues that they're facing. And I just thought that was quite a neat way of just capturing the type of data that we're wanting to know about. Catherine, I don't know if you want to jump in or say anything on that too.
Yeah, no, just to echo it, it's that kind of participatory data that you can start to make better decisions based on. And it's one of the themes that comes through a lot of our different recommendations when we're looking at different topics is, you know, how can we involve more groups of people in these kinds of decisions, so that we don't find that they have these unintended consequences or that they don't quite work for certain groups that they're supposed to serve. Someone has said something similar in the chat, that it was good to see a recommendation of having people with experience of homelessness and frontline workers to be involved in housing and homelessness policy. And yeah, very much when we looked at what had been happening in homelessness during COVID, that was one of the areas where we saw that as being quite a positive, was that those groups were already set up. There was groups who were already working with people with direct experience, which meant that, you know, when the pandemic hit and when suddenly we needed to restructure how we did services and we needed to think about how we were going to reach people, we were actually already in contact with people who had that experience, rather than then thinking, well, how can we get into contact with people after the fact, sort of thing. So yeah, just to continue on that idea.
We also included within the report, we had a section on prostitution in Glasgow, and it's a really tough area to write about because the data is obviously so limited. So you're kind of basing it on what data you can access and what you have, what data you've got access to. But one of the key things that was coming out was that any policy that was based around, protecting women within prostitution, protecting women who are exploited by prostitution, really must include the population that we're talking about. We really have to include women within those discussions as well. And we included some examples of that in our report, which I won't go into in detail now, but it just gives you some neat examples of, if you're going to be introducing a policy to, for example, to protect a population group, you really need to be hearing from that population group in particular. It seems like a no-brainer almost in a way. But I guess the tricky part is, how do you then access that population group and how do you then capture that data? And I think what Wise Women and the Glasgow Girls Club done with their app was quite a smart way of capturing that type of data.
Thank you. And Lynn has put a link in the chat to that, to Wise Women. So that's a great example. And what I'm hearing is really the more we have people involved day to day, the better. But then it's not a consultation at the time that something needs done. It's more people are embedded in the system and are part of it, and things can develop more organically, maybe. Would you see that being beneficial or not?
If I was just going to come in just to kind of build on that, I mean, one of the things we talk about was getting vulnerable groups involved in decision making about sort of some of the transport infrastructure that was brought in under the emergency measures during the pandemic, and a lot of that didn't work for disabled groups, and so I think there's a real challenge there in terms of involving people meaningfully at an early enough stage so that you can design the right kind of infrastructure. And clearly we've made progress in some areas, as Catherine's mentioned, in terms of homelessness, but in other areas I think that there's a lot more work that needs to be done to have this kind of meaningful kind of engagement at a time where you can, the plans are not kind of set in stone and they can be altered and changed, and no doubt there'll still have to be kind of compromises, and it'll be difficult to kind of please everyone, but hopefully in those kind of decisions, by making these kind of recommendations, saying that people with lived experience should be involved in the planning decisions, we get that sort of more informed, public planning happening.
Thank you, Bruce. There was also a point, Lynn will stop me if there's questions coming in because I've got a big list, is your point about alternative ways for access to services, and this is something we're talking about in our work with health and social care colleagues. That there was obviously a big move to digital, and we've had positive feedback. People can be more included a lot of the time, like today. People can all get into a physical room, but they were online together. But it's really important we don't just only do digital and people have no other means of engaging with services. So I know there's been quite a lot of work done about digital inclusion, but have you got specific recommendations to make sure we do have a breadth, or is that still, I know we're just talking about hybrid events and hybrid meetings and how we don't lose, because we're not on an equal playing field in terms of how we come out of the pandemic and the way that we work or the way that we engage. So have you had any insights on that?
I think from our work, what we've found is in some ways, when we do seminars, we're actually able to get speakers from across the world now, so who would not necessarily come to Glasgow. So in some senses, it's a lot easier to organise. We have a national public health seminar that I help organise, and normally it's in the concert hall with about 300 people. It's actually a lot easier to do on Zoom. But as you say, on the other side of that, you miss out on the kind of the kind of interaction, just face-to-face chatting to people at these events, and there will be people who can't access that sort of information because it's in a digital format. So I think it's something that we're all going to have to just kind of learn to do, and we're probably going to have to do a bit of both. We're going to have to be doing making information available digitally as we do on websites and through social media, but also the kind of face-to-face meetings are really important as well, and how we get to those kind of so-called hard to reach groups, but I think that's really important.
I think as well, in terms of access to services, I think it's almost important for us to remember that when we're talking about digital inclusion or digital exclusion more, there's almost like there's two sides to it, isn't there? There's the physical element in terms of having access to your phone or your laptop or your tablet or what have you. And I know that a lot of work is going on in schools in terms of giving young people, for better or for worse, iPads, in terms of giving them better digital access. But there's also the sort of background element of that. There's the actual internet access element. There's the dial-up speed, etc. And I think this ties into a lot of Catherine's work on homelessness, or at least for people living in more rural communities. And it's almost about recognising that it's not simply a case of having access to a computer within, say, a library or a school or something like that. It's how do we ensure that people have got access within their homes as well to good quality, high speed broadband, and then it ties into other elements as well of if you're experiencing homelessness or if you're in temporary accommodation, you don't then have the luxury of being able to sign up for 12 months worth of broadband, or you may not have the financial means to be able to do that either. Using your phone as a hotspot, for example, is then a more expensive way of accessing online, and then that can feed into your participation in the job market. And it's almost about trying to recognise that when it comes to access to services, there's a two-pronged approach there when we're talking about digital access, and how it then disenfranchises people who are more marginalised, or who are experiencing greater hardship.
Yeah, thank you. And the cost of living issue is adding to that as well for people. Julianne has been patiently waiting with her hand up, so I'd like to invite her in. Thanks, Julianne.
Hi there. I've just got a couple of things I want to point out. It seems to be that because of local authorities in areas are cutting costs, local organisations seem to be stepping up and helping local areas within Glasgow. So I work in North Glasgow, and it seems to be voluntary groups that seem to be stepping up to help people. But I feel as if it's going to get worse because funding is now really, really hard to access as well now. One of the groups I spoke to was a youth group, and it used to be youth workers within that area, and there's no youth workers anymore, so volunteers are now stepping in to do more. So I'm wondering, although these figures are from Glasgow, is this the same in places like Edinburgh, Dundee, other cities within Scotland? And if this is the case, can we not collectively put this together to Scottish Parliament, whatever, because there seems to be the figures that you had shown are absolutely shocking, and of course we know they're bad, but they're not to that extent. But the companies who are stepping in, local organisations, they're going to fade away if there's no funding, because right now our group seems to be, funding was there for everyone to access, but that's obviously just tithering away as well. So I feel as if it's going to get worse. There's rising costs. I mean, my niece, she works in a shop, and she's saying that they're increasing the costs of bread and milk, all the essentials, every other day. So it's just to see if the figures that you're producing on your report, do you know if you have access to this in Edinburgh and other cities, to see if this is something collectively we can present to do something higher up the chain, if that makes sense?
Thanks, Julianne. I think that's a really good question and quite a challenge. I'll maybe start off talking about the health figures, and then Catherine, Mary, you might want to come in after me. I mean, what we see in Glasgow with this reducing life expectancy is really quite historic. You know, if you imagine life expectancy has been increasing bar world wars for 150 years across the UK and across Scotland, and even in Glasgow, where health is poorer, it has been improving. So the fact that from about 2012, for the poorest parts of the population, life expectancy has been getting worse is really, really significant. But we also do see it in other cities across the UK. So it's not purely a Glasgow effect. It's affecting the most deprived populations. So I guess partly an answer to your question is, in more affluent places, that reduction in life expectancy, or the increasing mortality, however you want to put it, will be less severe. It's hitting people because of the kind of the structural reasons underlying it, the austerity policies, the taking money out of the welfare system and social care and so on. That's why it's the most vulnerable who are most affected by it. So I think it's being seen across Scotland, across the UK, but it's the most vulnerable who are most at risk from it.
I was just jumping thinking about the economy as well. So just over the whole report, obviously our focus is in Glasgow. Sometimes the data refers to all of Scotland because there's some data that you can't get at that level. But in the economy section, we did focus on Glasgow, but all of the things that were happening, the important things that were happening in the Glasgow economy at the time that we wrote it were all about COVID. So obviously that was worldwide. And again, what we're looking at now since then, with cost of living going up and cost of energy going up, and these things again are not Glasgow specific, so they're going to be the same, I would imagine, across Scotland, the UK, and possibly wider than that as well. So yeah, I'm trying to think about what other topics I covered, but again, when we looked at children and young people, like I said, this thing where we see that it's the youngest who are living in the most deprived areas of Glasgow. As I said, we looked across Scotland, and although the pattern is a bit less pronounced, it is a similar pattern. So for most of the areas that we've spoken about so far, I think you see that it's wider spread than Glasgow.
Can I just say, Catherine, based on your saying about the pandemic, I mean, we're slowly but surely getting over the pandemic, but then something else seems to kick in. For example, the Ukraine war. So that impacts people as well. So I know it's Scotland wide about energy, but there's obviously, we're focusing more in Scotland because it's where we live. And what's going to be next? So people are going to struggle through the pandemic, and they may be slowly getting there, but then you've got the Ukraine war. I mean, what else can hit people? I mean, places like where I work, people are going to food banks still, and then they think they're getting over that wee lick, and then this hits them. I mean, what else is going to hit them? Because like Glasgow City Council can't afford to bail people out all the time, so community groups are trying to at their very best, but it's difficult, you know, that way. So what's going to be next for people? What's going to hit them next? It's going to just, because that's the suicide rates are up as well, because people just can't cope. They just can't cope with life.
And that's something that we were asking a lot of ourselves as we were writing the report, what things should we be highlighting because what's coming up. We certainly talked about climate crisis quite a bit in those terms as well, and how that was going to impact people, and how, you know, at that time we're thinking, well, as the COVID impact starts to go down, that would be the next thing. But at the same time, there's always more things on the horizon that you don't know are coming, or you don't necessarily know are coming until closer to when they happen. So even when we were writing the report, we didn't know what position we would be in just now with a lot of that economic stuff. So it's difficult to guess what the next thing will be. But I think what you're identifying is also something that we have talked about, and we've talked about with other partners as well, is this sense of how do you talk about recovery and plan for recovery and think about a recovery when there's another thing coming on the other side of the crisis that you're in.
I think it's interesting that when we wrote this report, it was, oh my gosh, it feels like a lifetime ago away. We were looking at COVID because that was the big thing that was happening. And in our conclusion of the report, and I've just been bringing it up there, we noted that one of the key positives of the pandemic was that demonstration of how rapid policy changes can be implemented when required. We managed to do it in some areas, and they were successful in some areas, and it's about learning where that was successful and where there was unintended consequences. Now, of course, at the time of writing that, we then had no idea of the sort of financial meltdown that we seem to be in now, and with the war. And I think it was interesting that we're able to learn from one sort of global event or even a national event about the importance of really quick, rapid policy changes that have to come in to protect the most vulnerable. And I just think it would be very interesting if that same sort of learning can be applied now with exactly what we're talking about right now with the energy crisis, and obviously with the recession that we're going into. And we did pinpoint that in a report as well. And I guess it comes down to that idea of we need fast-term policy actions rather than sort of short-term politicians coming into play, isn't it? So that's all included within a report, within our recommendations, and within our conclusions as well.
Thank you. I'm conscious that there's another part to the presentation. We've got questions coming in. Jamila has put her hand up and down. I wasn't sure if you wanted to come in, Jamila, and then we can move on if that's okay, Bruce.
Yeah, is Jamila going to come in, or?
Yeah, just a small comment. Thank you for this opportunity. Just about the data about ethnic minorities, particularly about domestic violence. I think it is not the optimum or the better place to collect this data from the police, because they are very cautious for going to police, and they go to charities, and sometimes they get help or get mediation, but they don't want, our experience, they don't want to report the police. But we have record, and other charities also have record about domestic violence cases. Yeah, so maybe another source.
No, I think that's a very good point, Jamila. Thank you for making that distinction. We do mention in the report, and we are fully aware that the police recorded data is not a true and accurate reflection of not only the amount of domestic abuse that occurs within the country, but also the follow-throughs from that as well. Not every incident that's reported is then prosecuted. Although we're seeing figures are changing in terms of prosecutions, and that is positive, we do fully acknowledge in our report as well that when you're wanting to get an accurate and true reflection, if we ever can, is to look at charities data as well. And we do highlight that. So thank you for raising that.
So I think there's a question in the chat here about whether we think there'll be a rise in people returning to food banks because of the increased cost of fuel, essentially fuel poverty leading to more food poverty. I mean, it unfortunately sounds quite plausible to me. I don't know if you've got any thoughts, Catherine.
So yeah, just reading the question just now. I don't know about that specific thing, but having spoken to partners who work on food insecurity, have definitely heard accounts of food banks having to stock different types of food, food banks having to basically stock things that do not require cooking in order to be eaten, for that reason, because they're worried that people won't have the fuel to cook them, or because they're getting feedback that people don't have the fuel to cook things. So yeah.
Okay. Well, I think we should maybe move on. I've got probably another 5-10 minutes of slides, so I'll just share my screen again. Okay. People see that okay, the social capital one? Yeah, good. So in the interest of time, I'm going to focus on our recommendations in this and in the following sections. So one of our recommendations here under social capital in the community was to endeavour to build on the solidarity and community cohesion that we did see during the pandemic, and to enhance cohesion and trust within communities. So there's definitely something going on there during the lockdown period and other periods of restrictions, where people were coming together and really, brought communities together in some ways. Obviously, it was a difficult time, but it also brought communities together. And our other recommendation, which we've talked about already, is we emphasised the need to tackle digital exclusion and provide alternative service provision for people who face difficulties using digital media. Okay, so under places and green spaces, we've emphasised the need for a just and a green recovery, and we've noted that equitable access to good quality green space should be available in every community, and clearly the pandemic has shown us that that's not the case currently. And we also support the Glasgow City Food Plan, which amongst other things aims to build a thriving and sustainable food economy, and it will also be trying to make use of vacant land for community food growing. Under transport and travel, we note in our recommendations that the transition to net zero is an opportunity to tackle existing transport inequalities. And in this regard, we stress the need for meaningful community engagement, what I was talking about earlier, to enable all communities to benefit from the policy shift towards sustainable modes of travel. And finally, we emphasise the need to speed up that shift to sustainable transport as well, because if we're to meet our climate change related decarbonisation targets, if I can actually say that. So examples of that might be free bus use for the under 22s, trying to encourage more use of public transport. Okay, just a few final slides here. So in giving these talks on this work to a range of different audiences, we've been asked about data, not been able to analyse, and this slide shows the sorts of data people have been asking about. And has been pointed out earlier, the gaps in key data, there are gaps in the key data we would like to use, such as lack of equality data and routine administrative data, and particularly information on racial discrimination. So lots of gaps in what we might have wanted to present as well. And I thought I'd come back to this idea about positive policy responses. So we added this slide to illustrate examples of positive policy approaches that we think are or could make a difference to people's lives. So you can see here ones which are to do with income protection, the Scottish Child Payment, which I'm sure you're aware of coming in, increases in carers allowance. There's also under housing and homelessness, there's the housing first approach. Under transport, there's this shift to fund more active travel, walking and cycling, a commitment to introduce 20-mile-per-hour limits in built up areas in Scotland. Under the environment, we've got the Glasgow City Food Plan, the low emission zones, remediation and development of vacant and derelict land. Police Scotland are now taking a more of a public health approach to the policing, and there's been increased funding to kind of mental health. So this is an illustrative list. It's not meant to be comprehensive, and most of these policies, approaches that you see are national levels policies. So we're aware that finances are finite and under pressure, as we've been discussing. We also know that there's a tension between dealing with acute problems, things that are happening right now, and investing in policies for long-term change to make things better in the long term. And the balance between those two will always be debated. Not everyone will agree where that balance is. And I guess finally, it's just obvious, but it's worth stating that it's the UK government that controls large parts of fiscal policy and spend. Nevertheless, the Scottish government does have powers over income tax, some aspects of social security, and overall public spending in Scotland. And some of those examples in the previous slide illustrate some of the things that they've been doing, and probably they could do a lot more. So I'll come back to these questions that we left you with. Do you agree with these recommendations? If you do, what needs to happen to achieve them, and can you help? And I'll stop sharing my slides there. And again, I think we've got maybe a few minutes for a bit more discussion or questions.
Thanks,
Sorry, that was a bit of a rattle through.
I think we're all absorbing lots of information. When you ask, do people agree, and how can we help? Is there a plan for actions going alongside the recommendations, or is that this process? I know you're sort of on tour, if you like, communicating your report to various people, but if people do want to get involved, how would they do that?
I guess my take on it, and again, I'm sure Catherine and Mary might want to come in, is that we're probably in the last gig of our tour. But I guess it's about disseminating these findings and the recommendations. And I guess if people think that some of these recommendations are useful, maybe they will kind of support them, maybe they'll put them into consultation responses, maybe they'll sort of start to adopt them. Sometimes the way policy develops and things change is not very linear. I mean, we've presented to the Health Improvement Division of the Scottish Government, so they've heard all of this. We've presented to senior management in the Health and Social Care Partnership, the Health Board, the Social Recovery Task Force, etc. So, it's not as if a lot of people who are in senior strategic positions in Glasgow and Scotland have not heard this. And I guess we're hoping that doing these kind of presentations helps shape people's thinking. And I don't know, Mary, Catherine, do you have anything you want to add?
Yeah, I guess just sort of following on from that, we did create a document for Scottish Government and Glasgow City Council, I think, which sort of separated our recommendations into, well, what can you do locally, what can you do nationally? So that was may have been quite useful as well. And we have had a chat about the idea of following up this report in, say, a year's time to see what's been done, having a look at sort of the policy actions that have occurred within the last year since producing the report. Maybe even particularly sort of having a look at the organisations that we've presented to see how they've adopted it. And it could be a nice way of sort of saying, it's like health in a changing city, like 1 year on and what has changed. And I guess that idea of, policy change, unfortunately, isn't immediate and it's not linear. And as Catherine sometimes points out, it often has taken us quite a few presentations to same individuals. Not necessarily for a light bulb to click, but for to digest the information and to think about how they can apply it, or to maybe even speak to the right people as well.
Yeah, thank you. And there's lots of people here, which is great to see, who will be connected to different bits of work and can influence some of these conversations. Diane's just put a bit in the chat from impact funding partners who leading the socially connected Glasgow strategy. And I was just messaging you in the chat, this is so relevant to what's coming through in that as well, and our work with health and social care colleagues, Marian's here, my comms colleague, about how we, we're thinking about how we get those messages across and how we use, rather than being overwhelmed with all this information that aligns, is actually it should give strength to our voice and to what we've heard last year in our engagement sessions as well. So thank you so much. Oh, Susie's got her hand up. You just made it there, Susie. Nice to see you. Susie has a question, and then we'll round up this little bit. Thank you.
Hi, it was a comment more than anything, to say that I'm one of a number of third sector organisations that sit on the health and social care strategy groups on children's mental health and well-being and child poverty, and certainly this data and other similar data is kind of widely discussed within the groups, and thinking through about what what can be done about it. So account is being sort of taken of this material. The other thing that we have is GCVS runs a number of third sector networks, and pertinent to this discussion, we have networks on climate, and a sort of network group on climate change, which is pertinent to this discussion. Also one on children's mental health, and one on child poverty, and they're open to anybody working in the third sector in Glasgow with an interest in those areas. And all you have to do to join the group is email me and say that you want to go on the mailing list, and I can just add you to the mailing list should anybody be interested. The child poverty group talked about fuel poverty last session, and I think next week is talking about food poverty, and has some key speakers from the Health and Social Care Partnership and from the third sector, talking about how the third sector can respond both in the short term to the immediate crisis that we're seeing, with a massive increase in food banks, and longer term fitting into the food strategy.
Thanks, Susie. Lots happening for people to get involved in, so we can put links in and send that out to everyone if you're not aware of some of these networks that you might like to get involved in. A huge thank you to Bruce, Catherine and Mary. Lots of discussion coming, lots to get involved with and connect with. Thank you so much for that.